Mr. Speaker, I rise today in opposition to H.R. 3525, the U.S. Border Patrol medical screening standards. Before coming to Congress, I was a practicing physician for over 31 years. I also served in the 2nd Infantry Division in Korea in the 2nd Medical Battalion, where at that time we trained, spent a lot of our time in the field training for mass casualties and big events. And I went to the border. I've spent 4 days down there on 2 separate occasions. The last time was in June of this year with the medical director of the Department of Homeland Security, his chief medical advisor, and 5 other members of the Doctors Caucus at the McAllen, Texas, Rio Grande Valley sector to see for myself what was going on. At that time, Mr. Speaker, there were 1,000 to 1,500 or more people a day who came across. As we stood there by the Rio Grande River, 15 people walked up and turned themselves in while we weren't there more than 15 or 20 minutes. And we looked at the facilities they had about how they tried to screen these folks and then how they tried to sort them afterwards. And in Congress, it was a shame on us for not providing ICE more beds so you could move those folks off of the border more quickly. And with these folks, many of them have made long and terrible journeys to get to where they are. There is some good news, and I want to share this with you now. We just had a meeting today that the ranking member was on the committee, was there with the acting director of Homeland Security, and daily arrivals are now down 64%. Detainee numbers are way down from 20,000 in custody at the border to an average of 3,500 to 4,500 per day. And the best news, I think, are unaccompanied children have been reduced from over 2,700 to fewer than 150. So there have been great improvements, which will actually improve the health outcomes when you have time enough to go through and screen those folks. Can you imagine in a facility that's set for 1,000 people, and you have 1,500 or 1,800 people, you have nowhere to send them, that a flu epidemic breaks out. It is a very difficult thing to deal with. And so the folks at Customs and Border Patrol and Indies, I think, were doing a yeoman's job based on the situation they were put in. The problem we faced isn't the lack of adequate care or screening. It's due to the previously lax enforcement of our immigration laws and our Border Patrol agents just really being overrun with people illegally crossing the border. And really, without adding new and impossible to meet guidelines for our Border Patrol agents, we should look for other ways to intervene with illegal crossings, and I've mentioned that. These people are often, as I said, escaping unimaginable problems in their home countries, but once they reach our border, the CBP is doing the absolute best they can to help them. Now, the bill would accomplish very little, but overburdening our already taxed DHS staff with their limited resources. And this bill would require the DHS to purchase and implement an electronic health record within 30 days in order to coordinate care for illegal border crossings. Mr. Speaker, I think I'm maybe one of the only people in the U.S. Congress that's actually implemented an electronic health record in my own practice. It took us a year to do it in our medical practice to put 80,000 charts in it. Can you imagine putting over 1 million? And the U.S. military, the Department of Defense, right now is spending about $5+ billion for 1.5 million soldiers. The Veterans Affairs Committee, which I'm very aware of, and I'll be going to Seattle, Washington, Madigan on Sunday night and Monday of next week to evaluate their system. We're spending $16 billion to implement this. Let me say this to you. The DOD and VA spent $1 billion trying to implement and where the electronic health record at DOD and VA could talk to each other, and they failed. So it is a very difficult, complex situation to put an electronic health record in. I think it's a noble goal, and we should be looked at, but it's just something not doable in 30 days. I absolutely guarantee you it will fail. These are labor-intensive, and many of them fail. I know that, as I was saying a little bit ago, the Department of Defense and VA are currently implementing this program, which the total cost of that will be $25 billion. And this legislation gives DHS a colossal unfunded mandate that has no expertise or capacity to handle this, and would consume all of the supplemental that we've sent them. Further, implementing a new health record at a hospital takes a year or more, not 30 days. So it's absolutely a folly to think that DHS could do this, contract it, figure it out, train the people at all these ports of entry and do that in 30 days. Can't be done. The Coast Guard, a DHS component, had a disastrous experience trying to implement an EHR, about 40 clinics in between 2010 and 15, and they spent $67 million and gave up. So we can't deliver a modern health care record system to our men and women who put their lives on the line without spending billions of dollars in the better part of a decade. Why would we rush to develop one that's doomed to failure for people who are knowingly breaking our laws? Until the VA and DOD have secured a fully interoperative record for our service members, we should not divert scarce resources and time creating one for illegal immigrants. I do want to say that I'm willing to work with the other side in any way and all ways to improve the health care of the people who come here. We're Americans. That's what we do, and we're the best in the world at it. So if you want to sit down and work out an issue and a problem with me, I'm more than happy to do that. And with that, Mr. Speaker, I yield back the balance of my time.
Gentleman yields back the balance of time. Gentleman from Alabama reserves. Gentleman from Mississippi is recognized.
Thank you very much, Mr. Speaker. Mr. Speaker, I yield 3 minutes to the